We'll do 2, 3 activities today. Okay. First, we revise. What are stress hormones? Everyone right? What are stress hormones? Adrenaline and cortisol. What are happy hormones? Dopamine is happy hormone. Okay. Next, happy hormone. Serotonin, endorphin, oxytocin. Very good. So oxytocin helps in bonding, social interaction. Serotonin is secreted in abdomen, gut, with the help of good bacteria. Very good, very fast. And then it goes to brain, it gets converted to dopamine. Dopamine release depression. It is for mood. Endorphin is good feeling, happy feeling, blissful feeling. When we do activities and after that, if you are feeling good, very blissful, it means a lot of endorphin has been released now. Okay. If you want more dopamine, you should eat probiotics and prebiotics. You can watch that video on my channel, nutrition video. Gluten free also helps, yes. Lactose free, gluten free, lot of things. If you want oxytocin, you will interact socially. Okay. You will have friends, you will have good relation with your family members, or you will help people, or you will have clients. You will help clients. Okay. So you will go out, you will talk to a stranger. Okay. You will help a stranger. So help a stranger is counseling is one of the easiest and the best way to help a stranger. Okay. Endorphins is released when you clap your hands, when your mind rises to a spiritual level, a tranquilizer level, a lot of endorphin is released. It makes you feel very blissful, happy, calm. Okay. Now, three things: symptoms, trigger, emotional trauma. Symptoms means emotional turbulence. What are you facing day to day? What are you having? Low mood, low confidence, restlessness, irritability, anger, all those anxiety, stress, fear, worry, repeated thoughts, unable to sleep, sleeping more, eating more, less eating, all those things, fighting, and all those things. Okay. So these are symptoms. The trigger factor. So sometimes you are good, sometimes you are bad, but there happens some trigger, suddenly your mood drops. Okay. So those are the trigger factors. This factor can be very small or can be big also, depending on what is your emotional bank balance. So below this comes the emotional trauma, right? Earlier, the same trigger was not causing you trouble, but now it is causing because you had certain emotional trauma, certain betrayals, certain things, certain scenarios happen in your life that your balance is gone. So you are carrying the cup of coffee, someone hits you, and the coffee spills because inside is coffee. So you want to replace with milk or water. Okay. So whatever is inside the cup, it will fall. So emotional trauma. The other aspect which is very important is emotional bank balance. Okay. So there are some people, same traumatic event, their emotional bank balance is not depleted. They do not get triggered. They do not have these symptoms. But some people, they are very sensitive. Okay. So if you have high emotional bank balance, then your threshold for managing the pain, threshold for managing the turbulence, threshold for getting affected by trauma, threshold by getting affected, spilling the coffee is very high. Okay. For some people, it is low. Okay. There are some people who get repeated traumas. So if you're getting repeated trauma, you need to protect yourself from those people and cut those people from your life completely, whatever is the relationship. Okay. So emotional turbulence triggers emotional trauma or betrayals and emotional bank balance. Right? Understood everyone this concept? Very important. So when you take up a client, always start with this process: symptoms, trigger factor, trauma, and emotional bank balance. So first, your objective should be to help the client talk, right? And listen, vent out. So many times it reduces their trouble. Someone is there to listen. Then second objective should be emotional bank balance. How do you increase your emotional bank balance? Start with simple things. Breathing exercise 4-4. Okay. 3-5-2. So very simple exercise that helps to start your increase your emotional bank balance. A very stronger method of increasing emotional bank balance is good. Energy ball, energy sphere. Okay. Very good. It's a very strong and fastest method. Today we will do that. So energy sphere is the next level, right? You can do this every day. You can do this alternate. Okay. So it is good not to tell the client do it on their own, because then you are out of the picture. You want the client to come to you. Second thing, if client does some mistake, they may suffer. You don't want that. So that's why they need your assistance all the time. Okay. So all the techniques what you're learning, you will not tell them go and do. You will do it on them. Okay. They will always do it with you. Now to heal emotional traumas. Okay. So it is stored in the form of memories. It is stored in the form of images. So when we heal someone, we replace the memories. We replace the images, right? So when you visualize something, when you remember certain event, it is not written in form of letters. It is in the form of images. So you need to replace those images. You need to replace those memories. You need to break already existing synapses and form new synapses. Neuroplasticity. Very good. Okay. So this is neuroplasticity, right? So you break the synapses and form new synapses. Okay. And when you do that, your defense mechanism, probably earlier you will reacting some other way, but now you will react other way because your synapses are built wired correctly now. So you may uh, uh, so you may have certain habit, certain rituals, certain way of meeting people, interacting people, certain way of doing things. When you change your images, when you heal your trauma, all those things change. Okay. So you need to heal your trauma through neuroplasticity techniques. The hope is one of the very powerful technique, which is my copyright technique. Another copyright technique is the survivor, the dark hole and the angel. Okay. So these three techniques are very powerful to heal most of the emotional traumas in your life. Okay. So the hope is when you had no one to help you, you go back in time and give yourself hope. The dark hole and the angel is when you had at least one person to help you, or at least one person to look after who will pull you out. The third is the survivor. If you are getting affected by people surrounding you, presently, and all the negativity, skepticism, bullies, and all those things. You want to protect yourself. You want to increase your threshold, the survival. Okay. For grief, the trauma arising because of grief, either because of permanent loss or temporary loss, can be managed with grief counseling, starting with grief counseling, doing breathing exercises, and down the staircase. Okay. Then you will do advanced grief counseling techniques. So the three techniques which out of these two are my copyright. One is I release you, and second is the OSS. The third is meeting with the angels. We will see later. Okay. Down the staircase. So what are the uses of down the staircase? Down the staircase we use for forgetting something, stopping your thoughts, stopping your worries, stopping your fear, cut the train of thought. Okay. And so that some healing can happen now. Because you are already, your mind is trapped in the present thoughts or the previous problem, you are not able to think outside. So you need to cut the train of thought. You need to cut your conscious mind from the subconscious mind. So healing happens at the level of subconscious mind. Okay. So cognitive behavior therapy, why it fails, CBT, why it fails? Because the person is already having certain synapses, certain thought process, certain ways of action. And you tell that person now you start doing that so that your thoughts will change. You behave this way so that your thoughts will change. It is very difficult. The person is behaving a particular way because they have these thoughts, they have this synopsis. You cannot tell them change your behavior to change your thoughts. That's why CBT fails, the patient drops out, they run away, and it takes a lot of time to work. The faster way, the safer way, and the more cooperative way, the client is acceptable, the client accepts it, is a subcognitive therapy. In subcognitive therapy, we cut the cognitive function starting from 352, then down the staircase. We cut the cognitive function. We go to subconscious mind, and subconscious mind, we heal it. Okay. So all the techniques are healing techniques. Okay. Right. If someone has chronic disease, chronic pain, then healing with dolphin and the crystals is a marvelous technique for them. Okay. In subcognitive, when you're acting at a subcognitive mind, there are two ways now. So one is the fast method, fast in, fast out. The other is slow in, slow out. It happens exactly same effect as anesthesia. When you work at a subcognitive level, there is a tranquilizer effect you are inducing, okay, by some techniques. If you are inducing the tranquilizer effect, same as anesthesia, you want to use fast in, fast out. Old days, anesthesia was slow in, slow out, but it had lot of side effects. Same way, same way, these side effects are there for tranquilizer effect with our subcognitive therapy, right? In subcognitive therapy, if you go slow in, come slow out, or stay there long time, it causes a lot of psychological havoc. It causes anxiety, depression, all those things. You don't want that. There are some unethical counselors in the market. They use this technique so that the client comes to them again and again. You don't want that money. So you want to heal the client, fast in, fast out. So that client comes to you because the client is healed, right? So you will always use fast in, fast out. Okay. Sometimes the client wants to dwell in that scenario, in that healing session. You have to pull the client back. Okay. You can go back again, right? So if the client wants more, tell the client we will do this session again. But now it is time to come back. That is for your benefit. Okay. Don't tell the client the side effects. Okay. Question till now, please ask. So in psychotherapy, in psychodynamics and experiential psychotherapy, what are the things we do? We learn CBT and SCBT both. CBT worksheets you probably use certain places, okay, probably for engaging the client or involving the client if the client is cooperative or has willpower. But majority of the client coming to you, they don't have willpower, right? They don't have will to heal themselves. So you need to work at a subcognitive level. So we learn subcognitive therapy. Then we learn neuroplasticity techniques. Then we learn some techniques for increasing your emotional bank balance. Okay. So the neuroplasticity techniques and subcognitive therapy, it helps us to heal our traumas. Okay. It helps to heal the client. Good question, Sangeeta. So you can use rectangle breathing instead of 3-5-2. Okay. So sometimes 3-5-2 you cannot use because the client says client may have headache or client may have migraine or certain things or client is not doing correctly. So you can use rectangle. So for rectangle, simple, take a painting, take psychology book. Okay. So start longer is breathing and short is breathe out. Okay. Do not empty the lungs, right? You have to retain the carbon dioxide. Good question, Sangeeta. Any other question? Please ask. No one has a question? So there are girls who learn cooking by reading the book and they cannot cook anytime. And there are girls boys also, who learn cooking by watching their mothers. Okay. They are the best cook. They are the best chef. So you need to practically watch the demo, experience the effect, and then heal the client. Yes or no? Uh, you're mute. Any question? So there is a question, please help how to divide the 1 hour session with the client. You need to divide 1 hour session into like this. You do it. You do start doing it. Okay. So two options. We'll start with 4 4 3 5 2 down the staircase. After down the staircase, there are two options. So either we do energy sphere or we do healing with crystals and dolphin. Yes, Pratibha is like healing with crystals and dolphin. Okay. Okay. So those who write energy sphere, it means they think that emotional bank balance is low, they need to improve it. So good. And those who are asking for dolphin and the crystals, they have some body pain. They have some chronic pain either in their heart or in their body, and they want to relieve it. Okay, okay. Pratima is saying yes, sir, heart. Okay. So it's life. It's okay to have pain. We are going to have. So important is to increase our threshold, to heal it, and continue our work. This was about the psychotherapy, the summary. Now we will start in the next video.